Mark. As Mark just said, I've really come along. I don't know how many of you use iGPR, have come across iGPR. As you're all EMIS practices, it's something that was deployed to the entire EMIS web user base initially about 3 years ago. And when we developed it, really it was very much focused around trying to make the process of providing medical evidence to third parties more secure and ultimately a quicker process, so to cut down on the time involved in doing that, but also ensure that only the information that's supposed to be sent to the requesting third parties is sent to them. But what it's actually done is it's grown sort of almost organically to do a number of things in the same sort of space, which we'll go on and talk about. So in terms of what that covers, we've got insurance reporting, really sort of a lot of the work that's done by practices around third parties and requests for medical evidences for insurance purposes. We've then got solicitors, so you're getting lots of requests for things like subject access requests, which we'll come and talk about in relation to GDPR and how that's changed recently, or is about to change on the 25th of May. And then the last aspect is really sort of the patient online toolkit. So we've worked directly with the patient online team, as Kay pointed out, to develop effectively a screening function within the system to check records before you make them available, or not, as the case may be, to patients. So I don't have a whole host of slides. Really, I've got slide envy with everybody else in the room, got a lot of slides, but I've gone with one slide and just sort of walk through what it does. Quite happy to, as Mark said, take questions at the end. Normally the presentation will involve me sort of showing you the product, but I think given how much time we've got, we're really outside, so if you wanted to come and have a look at what it does, how it works, but just sort of, for now, we'll just talk through what it's all about, really. So, from an insurance perspective, it's about end-to-end processing, so the insurers that are enabled for iGPR have the ability to send a request to your practice on behalf of a patient, which will automatically allow you to then process the request through the software. Ultimately, the insurer should only receive the relevant and necessary information. So what's happened historically, they've asked for a range of things. All of the insurers ask for different sort of reports and different sort of aspects of a patient's record, but ultimately this controls that, so it's able to define and control what goes back. The key thing about the product is that it has this underlying redaction engine, so the purpose is to actually ensure that information that sits in the record that shouldn't go back doesn't go back. So in the case of insurance reporting, there are around about, we work with the BMA and the ABI, and there are around about 1,000 codes and about 2,500 words and phrases that are redacted when you produce a report automatically. So, you know, the sort of things that you would expect, HIV negative testing, all of that sort of information, predictive genetic testing, should automatically come out of the report before it's returned, which the system does. It analyses, and this is true across all three functions, it analyses the codes, the free text and the attachments. Okay, so it will actually look at the letters as well for you and redact information out of the letters rather than having to leaf through, you know, what could be hundreds of pieces of paper. It will do that automatically. The key part of the process is ultimately the audit. So a GDPR, being able to evidence what you've sent, what's been taken out of the report before you send it is absolutely critical. So there's an underlying audit report that's produced with every report that you create for an insurer, and ultimately that's filed back into the clinical record, so you hold an audit piece in the record but also the report itself if you wish to, and the audit report. Basically sort of moving along, then looking at sort of solicitors' reports. One of the things that's changed or will change under GDPR is that you are no longer able to charge for a subject access request anymore. So historically you've been able to charge up to £50 to produce it and then provide that to the requesting party. That's been removed, and so one of the things that we found, we've got now thousands of practices using the product, But ultimately what we found, certainly in the recent months, is that this concern around the amount of work that's involved and how that's done manually at the moment is something that's realistically not something that they can continue to do. So this will do that electronically. So again, it will generate a subject access or a full copy notes, as some practices refer to them, and it will then analyse the record to ensure that in this instance it removes primarily references to third parties, so it will go through and remove those third party references for you. The system, again, across the board will actually allow you to create your own dictionaries, so you can actually, if there are phrases and words or particular things that you don't want to include within a report over and above the standard sets, you can simply add them to your own dictionaries basically, and it will redact those for you. And again, coming back, it's very much about audit, so being, again, very much when you're producing a full set of copy notes, being able to show what you've done, when you did it, what you took out, and ultimately, as it says, you can then choose whether you want to redact further information from the reports that you might deem as sensitive or harmful, should it be passed over to the third party. Okay. Third aspect is that of patient online. So the process prior to having maybe an electronic screening function, but most practices, a patient will present, they will fill in the consent forms asking for access to their record. That could be the detail coded record, it may be free text. I think most practices are really only offering detail coded record. Whether Kay would confirm that or not, but generally if you're offering access to the medical record, it's detail coded. But ultimately there's a drive to be able to provide access to free text and ultimately letters, which will give them the whole picture of what's going on. The tool itself is really designed to take away that manual process of screening. So somebody's come in, they've asked for access to the record, that request will go into a clinician to actually generally sit down and look through the record and determine, is there anything in there that you wouldn't necessarily want to permit? Are they competent to have those aspects of the record that you might feel uncomfortable, that might be harmful? Examples we've seen, your patients that were adopted at birth, it's in the record, they didn't know that, they've been given access. It's just a very simple example of them becoming aware of something that could be harmful to them, could be unsettling, etc., etc. So it's those types of things that we've looked at. Working with NHS England, again, there's around about 900 codes and about 2,500–3,000 words and phrases that you would potentially find in a record that cover aspects of mental health, all those types of things, domestic violence, anything that you might find in the record that you would want to be aware of before giving a patient access, or actually you're bringing the patient into the practice to talk to them about some of the things that are in the record that might be of concern, that you want to make them aware of before you give them access to the record. Because obviously with EMIS you have got the ability to hide certain elements to actually from patient online access, and that's really what this does. It's about supporting that. Obviously the guidance from the Royal College and NHS England is very much that each record should be screened, but I think why we were approached by NHS England is it's acknowledged that to screen a record is quite a significant thing. There's a lot of data to go through, and if you're doing that manually, I think the test sort of showed it's anywhere between 20 and 40 minutes manually, whereas this takes literally 2 clicks, and as long as it takes to go through the record, which is usually sort of about 30 seconds to a minute, depending on whether you're analysing the actual attachments. But really that's what it's about. We wanted to sort of come along, just do a brief presentation. As I say, we can sort of demonstrate how the product works, what it does. But it's really about sort of supporting practices, with compliance, meeting GDPR requirements, ensuring that, data that shouldn't be shared isn't shared, depending on who's asking it and what the need is really. So.